Signs your hands will show that may mean you are having diabetes. What if the hands you rely on every day are quietly sending you urgent health warnings? Little dry patches, odd numbness, or strange nail colors could be flashing red signals. If this sounds far-fetched, think again. Your skin and nerves may be whispering the secret before any tests catch it. Hello friends. Today we explore a surprising topic: how diabetes can first make itself known through your hands. We usually think of thirst, hunger, or blurry vision as the first signs of diabetes. But your hands can speak volumes too. By noticing early clues in the skin, sensation, and movement of your hands, you might catch high blood sugar in the act. We'll calmly walk through what to watch for, why it happens, and what to do about it. Your skin is the largest organ in your body, packed with tiny blood vessels and nerves. When blood sugar runs high, the skin often pays the price. One common clue is dry, itchy skin on the hands. This isn't just from soap or weather. In diabetes, excess sugar causes the body to make lots of urine and pull water from cells, leaving skin dehydrated. The result? Your hands can feel oddly rough and tight, like they've forgotten how to stay supple. Another skin change: dark velvety patches. Doctors call this acanthosis nigricans, and it often shows up in creases like the neck or groin. But sometimes these velvety dark patches appear on your hands, elbows, or knees. If you notice a shiny brown or gray patch on your knuckles or palm, take note. It can be a silent flag for pre-diabetes or diabetes, signaling insulin resistance even if no one told you. Diabetes can also cause thickening of the skin on the fingers. A condition known as digital sclerosis makes finger skin tight, thick, and waxy. Over time, your finger joints may feel stiff and hard to move. This happens because high glucose changes collagen in your skin and joints, making tissues less flexible. Your hands might not ache, but they'll feel more locked up than usual. Have you ever felt a pins and needles tingle or numbness in your fingers? Maybe your hands fall asleep at night, or you get a shock when touching cold metal. While it can happen occasionally, frequent tingling or numbness can be a red flag. High blood sugar over time damages nerves, a condition called diabetic neuropathy. It's more common than you might think. In fact, experts estimate around 20 million Americans have diabetic peripheral neuropathy. This nerve damage disrupts signals, causing sensations like tingling, numbness, or burning in the hands and feet. Why does this happen? Chronically high glucose can injure the protective coating on nerves and choke off the blood flow they need. As a result, nerves misfire or die quietly. So when you feel persistent pins and needles or a loss of feeling in both hands, it could be your nerves warning you. Doctors note that numbness or tingling in the hands and feet is a classic sign of diabetes-related nerve damage. If these sensations happen without any clear cause, take it as a cue to check your health. Early management and better blood sugar control can prevent the tingling from becoming worse later. Diabetes impacts circulation and healing. One dramatic sign: wounds that won't heal. High blood sugar damages the tiny blood vessels and nerves that do repair work. Even a small cut or scrape can linger for weeks or months without proper healing. Medical experts explain that poor circulation makes it hard for your body to heal wounds, according to medicalnewstoday.com. If you get a cut on your hand that simply won't scab over, don't ignore it. The American Academy of Dermatology warns that persistent open sores are common in people with diabetes, as stated on aad.org. Clean any wound gently, apply an antiseptic and cover it, but also mention it to your doctor because it could mean your blood sugar needs attention. Think of it this way: sugar in your blood is like sandpaper in your body. It wears down the tiny pipes or blood vessels that bring nutrients to a wound. That's why keeping cuts clean and getting them checked is so important when diabetes is a concern. Diabetes can even affect the muscles and joints of your hands. You may notice swelling or stiffness in your fingers, even without injury. This is sometimes called diabetic hand syndrome or stiff hand syndrome. If you struggle to fully flex or extend your fingers, that's a clue. Doctors describe symptoms like inability to fully open your hand, fingers that stay straight, or simply a feeling of tightness. You might see mild swelling around the knuckles. Often the back of the hand will feel tight or waxy. Studies show that people with long-term diabetes may find their hands losing mobility, even if it doesn't hurt. This happens because high sugar levels make it harder for the body to maintain collagen in joints, and because tiny blood vessels in the hands, or microangiopathy, don't work as well. In plain language, elevated glucose glues things down. Your tissues get less blood, and proteins like collagen get extra sugar molecules. That makes everything feel stiff. Doing gentle stretching or massages can help a bit, but controlling blood sugar is the real key to easing stiffness over time. Pay attention to color changes in your hands and nails. One thing, your nails might look yellowish or brownish. Many people with high blood sugar find their nails become brittle or discolored. Experts explain this can be due to sugar affecting nail collagen or due to fungal infections, which diabetics get more easily. So check for unusual nail color, texture, or thickness. And see a doctor if nails are tough to trim or look infected. Beyond nails, watch your finger color. Circulation changes might make fingers look pale, bluish, or even red without any obvious reason. For example, digital sclerosis, which is waxy thick skin, can make fingertips look unusually pale or shiny. If you see any persistent color changes like a purple tinge or a white band on a finger, mention it to a doctor. These subtle shifts can be early hints of circulation issues or other problems. You might wonder why diabetes shows up in your hands at all. It harms small blood vessels. Tiny capillaries that feed your skin, nerves, and healing cells get damaged by high glucose. When they fail, skin dries out and wounds heal slowly. It injures nerves. Chronic sugar spikes damage nerve insulation and blood supply. This makes sensation like touch and temperature go wonky. It alters proteins. Glucose molecules latch onto proteins like collagen, stiffening skin and connective tissue. Think of your tissues becoming more like gummy candy, sticky and inflexible. It feeds infections. Excess sugar in blood and on skin acts like food for bacteria and fungi, increasing the chance of infections in wounds or nails. All these processes often happen slowly, but hands are on the front lines. With all those nerves and blood vessels, hands feel the effects early. That's why such a variety of warning signs can pop up in one place. If any of these warning signs ring a bell, don't worry, take steps to protect yourself. Check your blood sugar. Testing at home or getting a checkup is the first step. Knowing your numbers can guide your actions. Talk to a doctor. Clearly explain any hand symptoms. A simple blood test can confirm if it's diabetes related. Moisturize and protect. Apply lotion daily to combat dryness. Use gentle soaps and wear gloves when doing chores to prevent cuts. Tend to wounds promptly. Clean any cut or blister right away, keep it covered and check it daily. Seek medical care if it doesn't heal. Stay hydrated, drink plenty of water. Good hydration helps your skin and overall circulation. Eat a balanced diet. Reduce added sugars and refined carbs. Eating fiber-rich whole foods helps stabilize blood sugar levels. Exercise your hands. Gentle stretches or squeezing a soft ball can improve circulation and flexibility in your hands. Build a support network. Share your concerns with family, friends, or a diabetes support group. Encouragement and shared tips make a difference. These actions won't magically reverse diabetes, but they empower you to stay ahead of complications. Catching diabetes early often allows you to manage it with lifestyle changes and avoid more serious problems. Remember, it's better to be proactive than to regret ignoring subtle symptoms. Our hands do amazing work every day, and as we've seen, they can also be early warning systems. If you notice dryness, unusual patches, numbness, slow healing wounds, stiffness, or nail changes, listen up. These signs can be your body's way of asking for help. The good news is, you're not helpless. By catching these signs early, you take charge of your health. Many people have improved their health by simply paying attention to small clues like the ones in this video. Each positive step, like testing your blood sugar, moisturizing your skin, or getting medical advice, adds up to big improvements over time. You're not alone in this. We're building a community focused on supporting each other's health. In the comments below, please share any signs you've noticed in your own hands or tips that helped you. Let's learn and support each other. If this video helped you, give it a thumbs up and subscribe for more health insights. Hit the bell icon to be notified of our next videos, and share this with anyone who might need a gentle reminder to check their hands. Thank you for watching. Stay curious, stay informed, and keep caring for every part of your health, including your hands.